All right, welcome to our Week 7 regional report out call for South Central Kansas. It's January 26th, and we got a good group here for you today to hear what's going on. As always, I'll start with the dashboard. We'll jump into that. We'll hear from Seth on the public health side, from Dee Dee, and the hospital side. We got a special guest with us from Greenwood County Hospital. We have Dr. Watson on to talk about transfers, and then we have another special guest, Dr. Marcy Nielsen, who's the Chief Advisor for COVID-19 coordination. She's helping lead the vaccine efforts for the state. And so we have what will be a full show. So I'll just jump right into it for you by sharing the dash board here for this week. And generally, we're looking at good data again. I do want to provide some clarity here for you. So we'd spent a lot of time on our early calls talking about critical staffing shortages, and that percent of number is lower. And an important word is the critical nature there. There is still staffing shortages, and particularly for nurses are still being, there's a lot being asked of them. And so we're very grateful for all they're doing. Didn't want this to make it look like for 93% of hospitals it's a walk in the park, or the people working there. That's certainly not true. Now I'm going to come over to our hospitalized, confirmed or suspected COVID patients, 248. That's up 10 from last week, so still, but down from 271 2 weeks ago. Our COVID patients in ICU was at 88 2 weeks ago, 77 last week, now down to 70, so that's good. And then adult staffed ICU beds available. Again, this is a kind of a dynamic number. It shifts through the day when you think about all the beds we have and people moving in and out of ICU. 44, that's the lowest number we've had in a couple weeks, with 15% available staffed ICU beds available in this region. But good news here, when you look at what's going on with our weekly case count, it came back up over 5,300 here for a couple weeks, then to 4,000, and now down to just under 3,000, which is just really wonderful. We're also seeing our lowest, see if I still have this up, positivity rate. Ignore this. This is the last number here is kind of in motion as the week's progressing. But if you look for South Central Kansas, back in October here in 10-4, we were at 7.75, 8.84, then over 10%, over 15%. And the last 2 weeks, we've been under 10% positivity rate, 9.85% last week and 9.17%. So the lowest since October, which is also a really good sign. So that's the data. And now let's go hear from the ground. Seth Conkle, do you have an update for us, my friend?
Yeah, absolutely. So, John, I think you kind of hit on a lot of it. We're seeing South Central Kansas heading in the right direction. I think I'd reported out a couple of weeks ago that most of our counties were in the red, so to speak, which put them at that 15% or higher. Now, we've got a couple of counties in the green, a huge chunk of them in our region in the yellow, and then just a few still in the red. So definitely seeing things moving in the positive direction. I think that what we are seeing from a public health standpoint is the vaccine is not necessarily taking up the majority of the time, but it's definitely taking up a majority of the focus. So everybody kind of sees this as a solution. So I know Marcy's going to be on later and discuss that. But what I would say is, again, this does not, just because we're moving from vaccine and just because now our case rates are going down, does not mean we can stop the preventative measures that are science-based to help spread or slow the spread of the disease. Wash your hands, wear a mask, stay 6 feet apart, try and avoid large groups if you can. So I think we're going in the right direction. We just got to keep it up now.
Hey, Seth, I'm going to be asking this question on every call. When it comes to vaccine, do you know if Sedgwick County or any of the counties in this region have a sign-up place where you can put your name in and be contacted when it's your group's turn to come up?
Yeah, absolutely. So I think the best answer for that is to check into your local county's health department. Every county is doing something that's slightly different. They're all servicing people in a slightly different manner. They could be doing it, for example, let's say they're doing law enforcement or teachers. They could be targeting school districts or law enforcement entities versus just having a big clinic. You could see places like Sedgwick County, who does have a big clinic at Intrust Bank Arena. So everybody's doing everything's a little bit differently. That was part of the direction from the state, is that this is really has to happen at the local level. So I think they've even taken that piece of how do I sign up a little bit differently, and whether that's sign up to get an appointment or sign up to be notified of an appointment. Everybody's a little bit different, so I don't want to speak on any one county's behalf because it's so drastically varied.
Okay. How's that going in Sedgwick County? Can we just get that?
Yeah, I think everything's going great there, and I think just in general, I mean, I think the vaccines are coming into the counties. We're hearing constantly that we need more, we're ready for more, we want more. So I think health departments have got a good plan for getting it out, and those are getting out the door. And so we're just waiting for that influx or that increase in vaccine production.
Yeah, and so to put a number to it for people, roughly around 100,000 or 150,000 in phase 2 in Sedgwick County.
Yeah, that's probably about right for phase 2. Yeah, for Sedgwick County specifically.
Yeah,
I know that it's a couple of month process, like current vaccine production rates.
Yeah, we got 2,000 vaccines last week and 5,000 this week, or I think is what I saw. So just to give people a timetable for how this thing is going to drag out and why we don't want to let up. So I appreciate it, Seth.
Absolutely.
And Sedgwick County is going by age, right? So it's 83 and older right now.
Currently, right? Yep. That's how they've elected to do it. I would say that, again, every county's handling it a little bit differently. I mean, staying within that state guidelines of phase 2, but how and when they're getting all of the groups and all the individuals that meet that definition as identified in phase 2, they're all handling it a little bit differently, which is great. So that's why it's most important to check back with your local health departments. And most of them, I think at this point, have all that information up on their website. So you don't have to call them, definitely check their web address. Some of them use Facebook. So check those first and try and not burden them with a phone call unless you just absolutely can't find the information. Then I think it's a good idea to go ahead and reach out if you think that you're in phase 2 to find out where specifically within your county they're vaccinating you in that specific phase.
Thank you, Seth.
Absolutely.
Let me pass it over to Dee Dee and we can talk hospitals.
Hi, thanks, John. My name is Dee Dee Duell, and I am with Ascension Via Christi. And my normal role here is to serve in kind of overall in outreach. But my role for the purposes of these calls, I'm representing 19 counties and about 31 hospitals. And so actually, John and Seth have covered quite a bit of good territory for me, so I don't want to be too redundant, but I just wanted to add a couple of comments from the hospital side. Really hospitals are are happy to kind of see continued decline in the hospitalizations. And that's, the numbers keep going in the right direction, which allows them a little bit of breathing room, but at the same time, they continue to be very vigilant, and leaders are constantly monitoring the numbers in case they need to make adjustments or changes as needed. I know ICU beds are still at a premium, especially here in Wichita, I know for sure. And even at times, even our medical surgical beds can be tight, but as we all know, those numbers are very fluid, as we've always talked before, and can change constantly throughout the day. I know ICU beds are still pretty at a premium. And
Dee Dee, let me ask a question about that. Is that generally because we have a high need for ICU beds this time of year anyway? I mean, we build for kind of a peak this time of year, I think. Or are you seeing something COVID related that's driving that as a premium?
I think there's kind of a combination of things, John. I mean, we still have dedicated, quite a few ICU beds that are dedicated for COVID patients. So of course that reduces our normal ICU bed capacity, but we also, I think this time of year plays a part of it. But although at the same time, as other people have noted, we really aren't seeing a lot of flu hospitalization activity, but we have other ICU, and I think some of it could be related to maybe we're catching up a little bit on in some areas. So I think there's kind of several things in motion there.
And you may only know the answer to this for Ascension, but do you know, are we taking a lot of out-of-state folks into ICU? I know that they're out of capacity in Texas and Oklahoma.
I really couldn't answer you that on that for currently right now that we're taking several out of state. I do not know numbers on that, I guess.
That's fine. Not trying to put you on the spot.
But and I know Dr. Watson later will speak to this, but we're really hoping that some of these numbers will give us a little bit of more room, comfortable room on taking some of those transfers. And I know he'll cover some of that as well. And I'm really glad, John, that you covered some of the information, gave some clarity to the staffing numbers, the critical versus just regular staffing shortages. But just another point on that is that the staffing shortages or the staffing concerns will continue. A lot of those challenges and issues were in place happening before the pandemic ever came along. So especially in the rural hospitals, they continuously deal with some of the staffing challenges of just other areas that cause those on a normal basis. So I think hospitals now are a lot of them are really focusing on the vaccination as we move into phase 2 and what their hospitals are doing to support that effort in their county and for their local health department, county health departments, and really playing a good supportive role in that, because community members look to their hospitals to answer those questions. So their phones are blowing up, and I'm sure Sandy can talk to this in a minute, but they look to them to answer some of their questions and give guidance. So they're really placing a lot of focus on that because they just want to support wherever they can so we can just continue to get vaccines in arms. And so I think those are really the key points I wanted to add there. And so now I think I'm just going to turn it over to our next speaker. Sandy Dickerson is the CEO at Greenwood County Hospital in Eureka. And I know, their hospital staff and providers, everyone there has certainly had their share of experiences and challenges during this pandemic journey. So I was really thrilled that Sandy agreed to kind of share a little bit about their story. So Sandy, I'll just turn it on over to you.
So I'm Sandra Dickerson. I'm the CEO here at Greenwood County Hospital, and Dee Dee had asked me to share some of our challenges that we had with staffing shortages here at the hospital during this pandemic. And I want to preface this story with what I ask of the staff as the incident commander here and part of the team for our disaster preparedness. I ask all of the directors here to provide for me a plan of what they would do if they had a 25% reduction in their department for staffing, 50%, or a full-blown everybody's out type of thing, and also provide for me a plan for how they might help another hospital if we were asked to do something like that. So then about 4 weeks later, we had one of our departments experience a 50% shortage in their staff because of COVID, and it was our radiology department. And I will tell you, the radiology department director said I jinxed her by asking for the plan. 1 week later, we had the same experience in our lab department. Only within the lab department, out of all of the staff members that were in there, it was like an 80% reduction. I had 2 people, both of them were phlebotomists in the department and nobody else. So no one to run tests, all the MTs were out. And we had to call on another hospital to provide us some help. And they were really good about sending 2 MTs over because as a critical access hospital, we have to have blood bank available, and we didn't have anybody to run the blood bank. So they ended up bringing over some staff for, and that worked for a little bit, but they had to have their staff back at their facility as well because they were having problems themselves. So we ended up having to call the health department here and ask for a special circumstance to have staff who were out ill but not really, really sick be able to come in and work in the lab, and we had to lock it down. We had to provide the health department with a plan on how we would keep the rest of the staff safe and separated from these individuals who had COVID and were working in the lab. And it worked, but it wasn't fun. Our staff was scared at the same time. They were wondering, had I lost my mind by bringing sick employees back into the hospital to work? But it was exactly what we had to do to stay open and provide those services that are needed in our community. And we had been running pretty high on our census rate with COVID patients on the floor. So we absolutely needed our lab to be open. It was fun. And they told me I jinxed them as well. But here's the good thing. I asked for these plans. They were well thought out and executed according to the plan, and everything went fine. So that was all a good thing. With the bad also comes some good. So Dee Dee also asked me to provide you guys with like a story from our staff that's a good one and how we're working with our community. So we had a patient, not a COVID patient, but we had a patient who fell at home and broke their hip and has absolutely no family in this area whatsoever. Admitted to our hospital, sent over to Wichita to have surgery, and then came back for swing bed, and relayed to one of the nurses that they had a pet at home that had been there for a day already with nobody to take care of it. So our nurse got the keys from the patient, went to their house, got the dog, and took the dog home. And the dog is still at her house because the patient is still in rehab here. But that's the kind of service that our staff provide to our patients. Is just, I don't really know you, but I'm not going to leave your pet in your house to die because nobody's going to be there to take care of it. So I'm a dog lover. I'll take that dog home with me for a while.
What a story.
Yeah. So you guys have any kind of questions for me or anything?
Yeah, Sandy, I love your stories. They're both helpful. I mean, it's one of the things that I think we all love about Kansas, how well we try and work together and accommodate. And it's just amazing what we've seen in the healthcare systems and leaders like yourself to adapt and just figure out ways to make it work, to care for people. And then to hear that bright spot story, just about going above and beyond, it really paints a picture, I think, of things we've seen out of these healthcare heroes all across the state. But I really appreciate you bringing it to life the way that you did and the way that you serve Greenwood County and Eureka the way that you do. So thanks for giving us your time on this call.
Very welcome.
Yeah. I'm going to pitch it over to Dr. Watson now. He can talk about the transfer situation too. Dr. Watson.
Great. Dr. Richard Watson, Cheyenne Mountain Software. And we're looking at a lot more capacity in the system now. And I think Dee Dee said it right. Wichita is kind of interesting across the state in that capacity's still been tight across the board. And I think this is because they ended up taking a lot more of the high acuity patients, and they've just hung on longer in the system. And from what we can tell, it's more the selection of acuity than it is almost the volume even. But we know that that's still it's still a tight place, and we're still depending on the region to continue to utilize good practices to hopefully mitigate that. But transfer times, we're looking at an hour, 10 minutes on the non-COVID patients, and we're still over 2 hours of wait time average on the COVID patients. Fortunately, the bed finder side of it, they're waiting less time for the beds, but still about 40% of the patients are requiring assistance in finding beds. So the good news is volume is down, and I think that's going to be that has to be where it starts. The recovery of the initial surge starts is always volume goes down, and then the highest acuity patients that are in the longest have to that has to pass before the system really sees relaxation. So I've heard so many people say, I've gotten the first shot of vaccine, I feel good about that, I'm going to be out in the public, and it's almost like they've relaxed their whole idea about what that means. It's like, please no, that's exactly not the right way. And I mean, I'm amazed at how once even the vaccine first hit, everybody is kind of like, oh, well, great, we're over now. And then we realize, no, this is a trickle right now compared to even how we do flu vaccine. So
Yep.
great time to continue the word here for sure.
Yep. That's a good point, Dr. Watson. I had a good friend that got the first shot of the vaccine and then picked up COVID a week later.
Exactly. Yep.
So, just a reminder, everybody, it's, generally about 5 weeks after the first shot of Pfizer and 6 weeks after the first shot of Moderna before you're really considered immunized. You have to get that second booster and then a couple weeks after that. So as we're talking about vaccine, if you can make me the host again, Dr. Watson, I'll just pull up. We've talked about kansasvaccine.gov. They've been putting out the stats live for us as a state so you can see what's going on. Let me see if I can share that here to show everybody real quick. We showed this to you last week. Number of people vaccinated, you can see a first and second dose there. And as doses are coming into the state, we have moved up from 3.5% of the population to 4.5% this week. And then you can see the different age categories, the percentage of Pfizer and Moderna, male and female, and then kind of have first and second shot by week here. And then I like this new ad down here too, number of doses distributed by county per week. So you can, flip through and see how much is going to the different counties, and that's largely based on population. So with that, I'm just a reporter. We have a real expert, a chief, if you will, on the call with us today. Dr. Marcy Nielsen is the chief advisor on COVID-19 coordination for the governor and really helping lead the state in this vaccine effort. And so, Marcy, can you give us an update from your perspective?
You bet. Well, my partner in crime is Seth Conkle. So we are certainly working and jumping in to help all the folks who have been working now for almost, about a year now to address the pandemic. John, I'm not going to walk through slides because I think it might be more interesting to just get a sense of what the Q&A is out there. I can tell you, I have a background in public health. About a decade ago, I ran the state's healthcare agency, so my name might be familiar to some folks. This pandemic is like nothing we have ever seen, and I like Sandy's description of the importance of planning and how even if you don't want to have the horrendous thing happen, if you have planned for it, you're able to anticipate and sort of cope. I think in public health, we have talked about planning for pandemics, but it is clear that the United States was not ready for this pandemic. And when you look at sort of comparisons to other countries, the United States really has some room to catch up. Vaccination is going to be an incredibly important part of controlling the virus, but it will not save us alone. And so I appreciate everybody reiterating the importance of those other safety measures. We're at the state, We of course, are as frustrated as everybody else is that the vaccine rollout has been slow. We are frustrated that there isn't enough vaccine. We're hoping that the communication improves over the course of the next few weeks and months. And our job is to try to make your jobs easier by getting more information to you, by making the information we have more transparent. John, I appreciate you pointing back to the dashboard that we have up at Kansas vaccine.gov. We will add more and more information there and a map yet by the end of this week that will help folks in Kansas sort of navigate to those providers offering a vaccine. I won't say more. I want to leave a little bit of time for Q&A.
Thank you, Marcy. Team Marcy and Seth, we got the all-stars here with us. So Dee Dee, Dr. Watts, and Sandy, do you guys have any questions that you'd like to ask Dr. Nielsen while we have her? So I'll just ask you a couple, Dr. Nielsen, while we got you. So when you guys are allocating for the state right now, you said you only are knowing a week in advance what you're getting, federally. Is there kind of a math equation just by population density? Or are you measuring kind of how fast people are moving through phase 2? How are you guys deciding how much each county gets?
Yeah, great question, because as you know, phase 1 was fairly straightforward. Long-term care facilities, healthcare workers, we do a little math. Phase 2 is a little bit different. We've got about 1 million folks in Kansas who fall into phase 2. We have on average received about 45,000 doses a week, but that's if you add up both the prime doses and the boost doses. So we are using a formula to sort of an algorithm that takes into account geography. It takes into account the throughput in any given location, those providers' capacity to take Pfizer vaccine based on the ultra cold storage. And we want to take a look at communities that have a number of individuals very vulnerable to the disease. So a social vulnerability index. We hear all across the United States that in communities of color, we are not getting vaccine out as quickly as we'd like. I do think Kansas intends, as the weeks unfold, to try to offer as many vaccinations through mass vaccine events. We've got several of those entities already set up across the state of Kansas, but it's going to be important that we get out to where people are, and we're going to need to partner with folks all across the state to make that happen.
That's great. Really appreciate you being here and giving us that overview. Before we wrap up here, does anybody have final comments to make? Sandy, you shared a great bright spot story. I'm going to share that probably on some other calls. Really loved it. That human to human touch and just willingness to help a stranger. Highlights with the nurses. We also, in Pratt, Kansas, had a donor or a couple donors donate $95,000 to pay off 400 people's medical bills in Pratt, which is another great story I got reported on KSN also. So just some great things going on in our state. We appreciate what everybody's doing. Now's not the time to let up. And we will be here next week at this time, 1:30. If you'd like to sign up to receive the email, covid.ks.gov/report-outs. You get the dashboard and the email. And we can go from there. I appreciate everybody. We'll see you at 1:30 next week at the same time. Thank you very much.
Thank you.